My name is Tiffany Raffino, and I'm a social worker with the University of California, San Francisco Children's Hospital. And I'm so appreciative of being invited by CFRI to talk about resources to stretch your grocery budget. This is something that I feel extremely passionate about, and I'm just super excited to talk to everyone about today. So let me share my screen with some slides. Okay. So first, I just want to start with some basic premises for this presentation, right? And the first is that being a human is really expensive. I don't know anybody who doesn't feel some level of financial strain. And statistically, when we look at people with cystic fibrosis, 1 in 3 people with CF endorse feeling financial strain, right? So if you do, you are 100% not alone. And you may have noticed your CF center actually start asking about how you're feeling financially. And do you have enough money to buy groceries? And does your money stretch for the rest of the month? And the reason why we're asking is, first of all, again, because it is so common. I talk to almost all of my families about this, right? And so we're asking because we know that it's an issue for so many people. And there are resources to help. So if you take nothing else away from this presentation today, I just want to really acknowledge that your CF care team is here to help you. We understand how hard it is for so many people, and we really want to help. I also want to reference the CF Foundation Compass program because they have case managers who can really sit down with you, just like your clinic social worker, and think about some resources that might be available for you. So, this presentation is part of a 3-part series from CFRI about resources to stretch your grocery budget. So if you haven't seen part 1, I definitely recommend that you check that out because it goes into a lot of really specific tips from people with lived experiences, right? Like people with CF, what they do to help stretch their grocery budget that I think is really invaluable advice. And this presentation will focus more on just benefit programs and resources that are available. And so when I think about a grocery budget, right, and I'm sitting down with a family and I'm thinking about, okay, how can we think about how to stretch these dollars as much as possible? I'm trying to be as creative as possible, right? And thinking about, of course, the public benefits and food resources that might be available, but also, are there other areas where they're spending money related to their health, whether it's on health insurance premium or co-pays, medical bills, supplements, vitamins, utility bills? Are there other areas that we can tap into that there may be resources available to help offset some of those expenses and just really free up dollars for the grocery budget? So, in this presentation, I'm going to be thinking about this big picture and really thinking about, going over the benefit programs, thinking about nutritional support at school, national resources for food, help for supplements, co-pays, insurance, medical bills. I'm not going to go too deep into the resources, right? Because we could talk for hours about these things, but I want to give you some ideas of some things you could walk away with today, as well as some ideas of where you might be able to go to look for support down the road and people who are going to be there to help you. So I hope you really come away with even 1 or 2 ideas of things you may not have tried yet that might be worth looking into. Okay, so I want to start by just beginning and talking about the public benefit programs that are available. A lot of people who are eligible for these programs have not applied. We look at sort of nationwide studies. And so I just want to put in a plug for what these programs are and acknowledge that they can be a really important source of support. They might not be everything, right? It's not a magic solution, but it might be something that's really worth looking into for you and your family. So one of the biggest programs available nationwide is called the Women, Infants, and Children Program, or WIC. And it's a program that can offer help for women who are pregnant up to 6 months after delivery or breastfeeding up to a year, and children up to the age of 5. It's a huge program, helps half of all US born infants. So if this might be something that your child is eligible for, and certainly people with CF would meet the nutrition risk category, it's definitely worth looking into. There's a website at the bottom of this screen. It has a screening tool to see if you might be eligible. Another huge program nationwide is called the Supplemental Nutrition Assistance Program, or SNAP, also known as an EBT program. With this program, you can get an EBT card that can help you spend money at the grocery store. You're not able to get anything you want, there are some restrictions, but it can provide some support to you and to your family. Again, a huge program, 41 million Americans in 2022. Um, 12% of the population, or one of 8 people, are currently using the program, and even more are actually eligible but have not applied. I think, sometimes there's a stigma with these programs. People might say, oh, they're such a drain on our resources. And actually, here's just a fun fact for you. $1 in SNAP benefits generates $1.70 in economic activity. So actually, they stimulate the economy. These are really great programs for the US in general, um, and for the people who can benefit from them. One thing I want to mention is that people with supplemental security income, or SSI disability, it used to be that they would not be eligible for SNAP, but that changed in 2019. So I still meet a lot of families who have been on SSI for years, and they just have never reapplied because they were told all these years ago that they weren't eligible. So if that's the case for you, it's definitely worth checking out. SNAP does come with resources. So there can be some hidden benefits, like you can get a discount on a Walmart Plus membership. You may be eligible for free delivery from Amazon for groceries. So there could be extra benefits connected with having SNAP that could also be really helpful for you, especially if don't have the energy to always go to the grocery store. And sometimes it's really nice to have groceries delivered from Amazon. So definitely worth looking into. Okay. Another big program for nutritional support is nutritional support at school. This is a huge source of nutrition for our children in the United States. A lot of states have been really amazing in offering free breakfasts and free lunches ever since the pandemic. If your state is not one of those, there may still be opportunities for free or discounted school lunches. I did put some information about household income eligibility, but you could also be categorically eligible if you meet some of these criteria, like being a foster child, regardless of what your foster family's income is, um, if you receive SNAP benefits, if you receive your state Medicaid. So, school lunches are definitely something that can be a big source of support. In connection with schools, I also wanted to mention that some schools and colleges offer pantries available where you can pick up groceries. So, definitely worth looking into. And then, if your child is somebody who needs extra calories and they're willing to eat an extra, a bigger portion of lunch at school, you can ask for what's called double lunches as part of your child's 504 plan. And you can definitely talk to your clinic social worker about getting a letter of support for this. There are also just some national resources for finding food that I wanted to mention. So there's what's called a food pantry, right? Where it's a place you can go and pick up a bag of groceries. And there may be a number of different food pantries in your area. So maybe, for example, Monday it's at a local church from 9 to 12, and Tuesday it's at a senior center, and Wednesday it's at somewhere different. And a lot of these pantries are pretty easy to access. You don't need to fill out a lot of paperwork. Sometimes you just show up with an ID. You can check and see if there are any special requirements, like if a church, for example, wants you to be sort of part of their program, um, and see kind of what would fit best for you. It might also be worth experimenting with the different pantries in your area, because different pantries might have access to different food from their local food bank. So it may be that you just like the food available at a pantry that's available on Thursdays, right? Then you like what's available on Mondays somewhere else. So it could be worth just experimenting in your area. An easy way to find the food pantries that are accessible to you would be to call 211, or go onto 211 online, or go into findhelp.org. You could also call the USDA National Hunger Line and just see what's available in your area. So, so those are some of the things that people think about kind of right away when they're thinking about resources to help support nutrition and food, right? Is just literally like public programs and then picking up bags of groceries. But when I'm thinking creatively with families, I also want to go into some other categories of just medical expenses to see what can we offset to help free up their grocery budget. So, I want to talk a little bit about vitamins and supplements, because those can be a huge source, well, first of expense for people, but then of help if you can get resources for vitamins and supplements. So, one program that's available for people is the Healthwell Foundation. They do have an income requirement, so I put their latest income up here on this slide, and they can offer $1,000 a year for vitamins, supplements, probiotics. Um, One thing that I want to mention about Healthwell is that, for kind of the way the program is set up, is that you would pay for it out of pocket and then submit for reimbursement. But it may be that your CF center knows of a local pharmacy, maybe a Walgreens specialty pharmacy or a foundation care pharmacy that is set up to bill HealthWell directly. And that way it kind of cuts you out as the middleman. So your CF center can just send a referral for your supplements right to the pharmacy and they can bill HealthWell directly. And that's really a big help because it can be, first expensive to pay for the supplements out of pocket first, and then a lot of extra legwork to track to send in receipts and get reimbursement. So if that's something you've been doing and your CF center is able to help set that up for you, that can be a really big source of support for people. There are also some programs for people with commercial insurance, so employer sponsored insurance, that are available for people regardless of what their income is, right? So if you have an enzyme if your enzyme is Creon, it's the CF Care Forward program. If your enzyme is ZenPep, it's the Live to Thrive program. And these programs offer a tremendous amount of support. So not only can you order free vitamins and supplements from these programs every month, Live to Thrive also offers a point system where you can order different medical equipment, but they'll also give you copay assistance for what you pay at the pharmacy when you pick up your medication. And again, these are available to people regardless of what your income is. And then I also want to just touch upon programs that can help support people with copays, insurance, and medical bills. Um, this is something you could take a very deep dive in. So I'm not going to go too much into the details, but I wanted to give at least some ideas of some programs that are out there because this can be a tremendous expense for people and a tremendous source of assistance if you're able to tap into resources for support. Okay, so the first programs that are up here on this list, the Assistance Fund and the Health Law Foundation, those can both offer really substantial financial support for copays. And sometimes they can also help with things like the Assistance Fund can help with deductibles and co-insurance. The Health Law Foundation, this is different from the Vitamin and Supplement Fund. This one offers up to $15,000 to help with medication or equipment, or you can ask for them to help with health insurance premiums. So I work with a family, for example, they pay $750 to $800 a month just for health insurance premium, and Health Law Foundation is able to help them with that. So a tremendous source of assistance when you're looking at the total year of expenses. Now, both of these programs um, have had times when they've not been open for applications. The Health Law Foundation has fluctuated a lot in the past few years about when you can renew or apply. As of yesterday, when I checked, June 5th, it was open for new referrals. Likewise, the Assistance Fund was also open, and that's the first time I've seen it open in quite some time. It was previously a waiting list. So I would not hesitate to apply for these programs if you think that they can help. If you have a lot of medical bills from your hospital, I would not hesitate to call your patient financial services department and see if you might qualify for either a discount or 100% financial support on your medical bills. I know the hospital I work for in California actually offers very generous financial assistance, and people are often really surprised to find out that they do qualify. You can also, if you have medical bills, offer a payment plan. Maybe you owe, $10,000, but you're like, well, you know what? I can pay $20 a month, and that's what I can do. And oftentimes, a hospital is just really willing to have money coming in every month and not having that bill go to collections. And so they might be willing to accept a payment plan, even if you owe thousands of dollars. You don't have to pay it right away. I would also, think about if you do have an insurance plan where you have a lot of expenses, might there be an option for you that might be more optimal, right? Is there a different plan offered through your employer or through a state marketplace plan? Or do you qualify for supplemental insurance? I know, in California, young adults who are 18 um, can apply for Medicaid as an individual, irrespective of their parents' income. So that might be something worth looking into with your hospital social worker or with the CF Compass program to see, is there an insurance program you might qualify for that can provide extra coverage for you, or that the coverage might be more comprehensive. So your clinic social worker or Compass can help you look at that. And then I also wanted to put a couple of programs on here. At Needy Meds, you can plug in the name of any medication and see if there's a copay program associated with it. So that can be a big source of assistance. And then for, again, the big expensive CF drugs, like we already talked about the enzymes, but Pulmozyme, for anybody, regardless of their income, They have a program where you pay no more than $30, right? So a huge source of help. And then the CFTR modulators, right? We know how expensive those are. Vertex also offers their GPS patient support program. It's more of a case by case basis of whether people qualify financially, but it could be a phenomenal source of support. So definitely worth looking into if you haven't already. And then again, talk to your clinic social worker or Compass to see if there are more resources available for you. I also wanted to touch upon the fact that there exist these wide array of nonprofit organizations that can help people with CF or people with kids or people with medical conditions. I'm just going to mention a couple here that are really amazing and that can offer, again, tremendous assistance to people. All of these, the Bonnell Foundation, Boomer Esiason Foundation, Cystic Dreams Fund, Claire's Place, Piper's Angels, offer tremendous support to people with CF. Sometimes they can help with things like offsetting expenses when you're in the hospital more than 14 days, or the Boomer Esiason Foundation has just a general financial assistance hardship grant, as well as support specifically for transplants or for IVF. So these programs are really incredible. A few others I just wanted to mention that are specifically for CF. And again, I could talk for hours about these, but things I talk to people about every day. The CFRI offers help for mental health, which is a tremendous source of support. Breathe Like a Boss and Breathe Strong CF both offer support for exercise. And we know how important and just how tremendously beneficial exercise can be for people, not just medically, but also for their mental health and for so many reasons. So both of these are wonderful programs that can offer a really substantial amount of financial support for these programs. There are also programs specifically for children and young adults that I use all the time with families. Ellie's Army offers financial support for children and young adults. There's no income limit for this program. Sometimes I'll have families apply for rental or mortgage assistance when their child is in the hospital or for hospital bills. Oracle Health Foundation and United Healthcare Children's Foundation both offer grants for children that can be very substantial to help with medical therapies, therapy, travel and lodging, lots of different things they can do. There are also general nonprofits that can offer financial help. So I mentioned 211 and Find Help earlier. Not only can they help with searching for local food pantries, but you can also search for things like local rental assistance or utility help in your area. You can go onto their websites and see all the different categories of things they can provide support around. There are also just nationwide programs, Catholic Charities and Salvation Army, that have branches all over the US. And sometimes they can also offer help with things like rent or emergency needs. And then there are lots of programs that can help with just utility expenses. So the Lifeline program can help with cell phone bills or phone bills. The Low Income Home Energy Assistance Program is also really helpful. They can do a variety of things. Like I've seen them help families with weatherization. So just making sure that your home is sort of as weather appropriate as possible, or replacing old appliances for more energy efficient appliances. Like I worked with a family once and they reached out to this program and they couldn't believe that the program helped them with getting like a new refrigerator and a new dishwasher, things that were more cost effective and really reducing their energy bills. Energy related minor home repairs. You can call your utility company if you're unable to pay your bill one month. They might be able to offer support for you, or maybe you qualify for a program with your utility company if you meet certain income guidelines. Like in California, you can get 20% off your energy bill. Your utility company might also offer a discount if you use medical equipment, right? So in California, we have a program called the Baseline Allowance Program, and you may have a program that's similar where you live, where they can reduce your energy bill if you have medical equipment. So all of these things, again, can really just, when you're pulling resources from all these different places, can really help. Transportation, your insurance company may offer financial help with transportation. I also learned today, insurance in some places might help with food. So it's worth asking about these things to see what other benefits your insurance company might offer that you wouldn't even think to ask about, but that can really be helping you save money down the road. Um, there are some cookbooks and tips for tight budgets that I just wanted to mention. And I know as part of this podcast series, part one talked a lot about some tips for spending money or saving money at the grocery store. And then part three is going to have a chef who will give you some tips. And here are just some extra information, some cookbooks that might be worth looking into. So, the Balanced Budget Cookbook, this Eating Stuff is Hard Work, Cystic Fibrosis Recipe Book, these recipes and tips for the CF community from CF Chef, the My Plate tip sheet, and then I'm going to go on the Good and Cheap cookbook. All of these were designed for people with using the budget with SNAP, right? So really thinking about how to really stretch the dollar. And then the CF specific ones are even thinking even further on a CF diet and what's going to be specifically helpful to CF. So it might be worth checking out one of these free cookbooks that you can download to see if there are any ideas for you. I put this website here, 20 tips to save money at the grocery store. And then I wanted to acknowledge resources for support, right? So again, as a clinic social worker, this is what we're here for, right? So we talk to families every day about these resources, and we would be happy to talk with you about your situation and what might be available for you, both at our hospital as well as locally and nationwide resources. And the CF Foundation Compass program as well offers phenomenal case management support. And I would honestly reach out to both of them because your clinic social worker may have some ideas and Compass may have some ideas. And again, we're really thinking about the big picture and just trying to kind of weave in all the different layers of support that are available. Um, and I want to acknowledge, right, that it does take legwork and it does take effort. And all of these programs do have applications and they are time consuming, right? And it may be possible that your clinic social worker or Compass can help to a certain extent with some of the applications that you may have. So it may be, I know when I work with people, I'm like, okay, here's your list of things. Here's my list of things. Let's see what we can do to help support you and have this not feel quite so overwhelming because it can be hard. And there's like, well, there's 50 things. Where do I even begin? Like, what's the most helpful place to start? And that might be a good question. Maybe you only have energy to start with one application and you can see, okay, what's going to be the most beneficial, like the most bang for my buck for my time and energy of where to begin. And just know the others are there for you when you have the time and energy to work on that. Um, and when you actually do get accepted, sometimes you really feel that support. Like I'll tell the families that I work with, like, okay, I know it's a lot of effort to put this application together, but here's the payoff that you're going to see. And it really can be worth that time. So we can be your cheerleaders, your advocates, your resources. Definitely use us. We are 100% here to help. And I want to thank CFRI again for inviting me to speak. I definitely want to encourage you to check out the other two podcasts that are part of the series. And I wish you all the best to you and your family.